True or false? Medicare is free. False. Medicare is not free. Hello, Tom Matthew here with Sacred Life. In this video, we're going to go over the different parts of Medicare and their associated costs. Stay tuned.
The four parts of Medicare include Part A, hospital, Part B, medical, both of which are provided by the federal government, who issues beneficiaries a red, white, and blue card that looks like this. Part C, Medicare Advantage, and Part D, prescription drug coverage, both of which are offered by private insurance companies who have contracts with the federal government to provide Medicare benefits. As you can see here, Part A helps cover hospitalization benefits, skilled nursing facilities, hospice care, and home health benefits, while Part B helps cover what you would traditionally think of as outpatient care, doctor appointments, labs, diagnostics, day surgery, preventative services, occupational physical therapy, and home health. Both Part A and Part B generally comes with deductibles and coinsurance that the beneficiary is responsible for paying. In these slides, we're going to walk through Medicare premiums and out-of-pocket costs. These costs do change year over year, so I will insert in the description box below links to where you can go out and find those costs, if not this year, next year. So for purposes of these slides, we'll be going through the 2023 costs. With Medicare Part A, it is premium free for those who have worked at least 10 years and paid Medicare taxes. Now this can be based on you or your spouse working at least 10 years and paying those taxes. If you and or your spouse have not fulfilled the 10-year work requirement, then you could be paying either a $278 per month premium or $506 per month premium, depending on how long each of you have worked. Here are your Medicare Part A inpatient hospital out-of-pocket costs. During the first 60 days in a hospital, which is also known as your 60-day benefit period, you have a deductible to meet of $1,600. Once you pay that, Medicare pays the difference. If you are in the hospital for more than 60 days, from day 61 through day 90, you have a copay of $400 per day to pay to the hospital. Now, Medicare allows you an additional 60 days thereafter through the course of your lifetime to use if you need to use those additional 60 days. In those circumstances, you have a copay to pay of $800 per day from day 91 through day 150. If you are in need of more hospitalization beyond those 60 lifetime reserve days, then you pay all of those costs, and Medicare does not pay anything. Medicare Part A skilled nursing facility. So Medicare covers 100 days in a skilled nursing facility. This is referred to as inpatient rehab. The first 20 days that you are admitted, you have a zero copay obligation. If you are in the skilled nursing facility for days 21 through 100, your copay is $200 per day. And if you're in the skilled nursing facility for day 100 or above, you are paying all of those costs yourself. Medicare Part A home health. In this type of benefit, you have $0 to pay. Medicare Part A hospice care, which is also referred to as end-of-life care, you have a zero copay obligation if you have entered hospice care, although you may have to pay up to a $5 copay for any prescriptions that are used to help with your symptoms and pain relief. Medicare Part B, also known as outpatient care. The standard monthly premium for Part B this year in 2023 is $164.90 per month. If you are in a higher income bracket, that premium could be more than the $164.90. Keep in mind also, if you do delay enrollment into Part B and do not have any credible coverage upon first being eligible for Part B, you could expect a penalty that could be added on top of these rates. The annual deductible to meet under Medicare Part B is $226. This includes any outpatient services except for Medicare covered preventative care. So you pay the $226 first in the year, and then every expenses thereafter is covered by Medicare at 80% while you pay 20%. Now here is an outline of services that are not covered by original Medicare. First, custodial or long-term care assistance that includes bathing, dressing, continence, and eating, either at home or in a nursing home, are not covered by Medicare. These services generally are covered by your state Medicaid benefits if you qualify for that on the basis of income. Second, hearing aids and routine hearing exams are not covered by original Medicare. Routine eye care, most eyeglasses, with the exception of a pair of standard frames that you might be prescribed after cataract surgery. Most routine dental care, including dentures, are not covered by original Medicare, as well as health care received while traveling outside the country, except in limited cases, such as if you're going on a cruise, Medicare might cover services up to a certain distance that you're away from the coast.
Well, that about wraps it up for today's video. I'd like to thank you all for joining and watching. I will add some links in the description box below related to some of the topics that I discussed. If you would do me a favor and click the like button and subscribe, and feel free to leave any questions or comments at your leisure. To your health.